The thing and I'm saying this in a constructive and caring way towards my friends who practice, insurance-based medical care. A lot of this came because of the dismissal rate of these patients in for other conditions, for many other things. When a patient comes into clinic to see you and you're only allowed to have 15 minutes for them for a complex case, they lose trust. They don't feel heard by you. They don't believe that you're going to be there for them because you physically can't be there for them because you're not going to be compensated for that. And whoever you're working for wants you in and out of that room. And I know it. I get it. And that's not what you all set out to do when you went out to medical school, I know. But this is where we are now. A huge percentage of the population is denying medical care because of these experiences they've had. When people are unwell, that brings on a tremendous amount of uncertainty. I remember the first time I saw my liver enzyme elevations being high. I was in a lab rotation. We were learning how to use the lab at the clinic, and it was in med school. And we did a, urinalysis, and I saw, it looked like something's going on with my liver. And I was like, what is this? I had a panic attack. I had anxiety. Freaked me out, Now as a physician, looking back, I'm like, dude, that's nothing. Don't worry about it. You stop eating gluten. So that's what it was. And, but I had so much anxiety over it. When a patient sees something wrong in their health, you will feel anxious and worried because you don't know what's happening. That uncertainty is a big deal, and it's a loss of control that they've always felt that they had naturally occurring. Like blood pressure's high now. Well, that's uncertainty. That's a loss of control. So they felt they always had good cholesterol. People gaining weight, that's a loss of control. They always felt like their weight was under control. What is this? This is a very insecure thing for human beings. It just is. And if you deal with it every day in your clinic, people in and out your door all the times, you could become desensitized to them. It's something that you'll start seeing as being trivial, but to them, it's the world. And they are right. And if you can't see it, this might not be the right field for you. Because it's the human being in front of you that matters most. And validating that human being and seeing them in the moment. And that's empathy and care. That's what it means to be a physician, in my opinion.